Okay, we're going to be talking about Skinuva, which is a great company, some tried and tested scar therapy products, but we're going to talk about Skinuva Bruise. There's two different preparations, tablets and a topical product. So Joe, Skinuva Bruise has multiple things in it. There's Arnica, there's bromelain, there's multiple other products that have helped with bruising. Yeah. So why would you want to use a bruising or anti-bruising product in plastic surgery?
Yeah, I think they've got a lot of great ingredients in this product, and it includes some things that target obviously bruising, inflammation, as well as wound healing. So it's multifactorial the way that they're approaching this product, which I think is fantastic. Our patients are more educated about recovery. They want enhanced recovery. So now you have something that you can offer them prior to surgery to help with that post-operative recovery. I think that's critical.
Yeah, Johnny, I know you actually have experience using Arnica, which is one of the primary products that's in the Skinuva Bruise. So tell us about your experience with that. You do a lot of facial surgery, so that I think bruising is a big deal. So kind of walk us through kind of what your experience is.
So, we recommend this product, primarily because patients are a lot more educated nowadays. And, they want to have a quick surgery, they want to have a quick recovery. And if you're bruised a lot, obviously it sets back their activities and to be socially acceptable. But having them use this product a couple of days before, continue on for a short period of time afterwards, it really decreases the amount of bruising and the quality of bruising, and you basically debruise quicker.
And Ed, I think your experience is unique, I think, because I know you've used Arnica. Mm-hmm. You also have used some other things for bruising, but have you seen any of these anti-bruising products out there as a differentiator or driver for better patient experience?
Absolutely. We use special medications during surgery, but I think it's really cool you're talking about the education. Starting a bruise pill with this Arnica 1 to 2 days before surgery, not only does it feeds that kind of education that people want, but it's proactive. We can do more before we get there. And again, less bruising, we're out back in the community faster, maybe going back to work faster, especially with facial surgeries, especially like lower lids, bruise all the time. Having a little something to put on there and even take in advance just expedites that recovery.
It sounds like I should start using some of this, but it comes in tablets, and this is a 7-day supply. I typically recommend to start 1 to 2 days before the procedure and then finish out that supply through 7 days. And then the topical. I think the important distinction is that it's homeopathic Arnica, because the regular Arnica can be toxic. So this is homeopathic Arnica, which is the preferred preparation, obviously. Do you see, Joe, using both products in conjunction with each other in your practice?
Yeah, I think this is something that you could differentiate your practice with, especially if you give a patient something beforehand saying like, hey, this is our plan for preoperative management of our healing and then postoperative management of our healing, and it combines well with the scar gel that they already have, and they have great data behind it. So you can give them those two things and say, hey, this is our plan going forward, and we're going to improve your recovery using these two agents.
Yeah, I really like how you mentioned the studies, because I think their scar products are really the only things that they have. They're unique. They have unique ingredients, growth factors, other things, and they're scientifically proven to be superior. And so we've had a great response with all three of the Skinuva scar therapy products. Johnny, I would imagine, especially in the stuff you do, facial stuff, if patients look good, then they feel good. If they've got tons of bruising, they're going, oh man, like I'm bruised for a long time. There's got to be some mental benefit to decreasing bruising.
I think you hit it right on the spot. The mental benefit is you're letting the patients take control, having them take the meds themselves, and kind of inspires confidence in their own healing and inspire confidence in their surgeon.
Ed, okay, we were talking earlier and you were saying that there's some additional things, especially for body applications. So tell us about kind of your thoughts, like non-face use of Skinuva Bruise.
So let's take like a tummy tuck with liposuction. We have all the great silicone-based products that we're going to apply to the scar, but what about the bruising on the flanks? This is giving the patient something active they can use twice a day, directly on their bruises, directly on the area that's bothering them, and hopefully speed that process up.
Okay, well, those are great points, guys. Skinuva Bruise, yet another great product from Skinuva. You can see more of this on their website, or you can see it on the plasticsurgerychannel.com.